Malacanang comes to the defense of Public Attorney's Office Chief Persida Acosta, who has been blamed for the ongoing measles outbreak. Acosta is prosecuting former health officials responsible for the distribution of the dengue vaccine Dengvaxia, which allegedly caused the death of a number of children. Critics say her campaign led to low public trust on immunization. But for Malacanang, Acosta is only doing her job.
The PAO chief, as a lawyer, is defending or pursuing a theory that favors the clients. In other words, he's pursuing an advocacy, an impassioned one. So I cannot blame her for that.
Panelo says President Duterte is saddened by the measles outbreak, especially since children are the ones affected. He says Mr. Duterte ordered the health secretary to resolve the problem soon through a vigorous campaign to promote the complete immunization of children. The Public Attorney's Office Chief Persida Acosta also drawing a lot of flack online. This netizen says, quote, "Nakakainis si Acosta, kasalanan niya yung measles outbreak na yan, puro politika eh." Another Twitter user makes it clear it's not the entire Public Attorney's Office that's at fault, just Acosta. Mikey Alvaro making a play on words. He says PAO should be blamed for the measles outbreak, but he says PAO stands for Persida Acosta only. And finally, this citizen says the problem was never Acosta saying kids should not be vaccinated against measles. Instead, it was Acosta attacking the health department and, quote, villainizing healthcare. Health workers taking a more active approach in vaccinating children. In some villages, nurses are going directly to those who need vaccination instead of waiting for parents to bring their children to the clinics. Rex Remitio filed this report.
Health workers have been going door to door to vaccinate children all day long in Barangay Commonwealth in Quezon City. Since the start of the year, there have been 11 cases of measles in this area. 2 patients have died, the biggest number in the city. It's all hands on deck for the health workers. They still have to check on more than 20,000 children in this barangay alone. As they go around, they ask parents if their children have been vaccinated.
Saan kayo nang galing? Nagkakakuha siya ng tigas?
Dito lang naman po.
Dahil mayroon nga kami dito yung kaso. So nahawaan pa si baby, nakadalawa.
Pangalawa niya na po yung tigas eh.
The health department has allowed 6-month-old babies in outbreak areas to be injected with the vaccine. The usual age is 9 months. The second dose of the vaccine is given when the infant turns 1 year old. Children also have to be injected with the vaccine booster at least once before they reach the age of 5. Most of the parents here say their children was vaccinated only 2 times. That's why health workers are immediately giving the kids the vaccine booster. Some kids cannot help but cry as they are given the injection. But their parents say it's better than being unprotected and later being sorry.
Uso po kasi ngayon tigdas eh. Baka po maano po siya. Mahawaan, mahirap na po.
Laganap na po kasi ngayon yung ng tigdas eh. Yeah, para secure lang din po yung mga baby.
The door-to-door campaign against measles might last for more than a month. This is because the number of nurses are limited and can only vaccinate up to 60 kids per day. Parents are advised to bring their vaccinated children to the health center for a follow-up checkup after a month. If their children was never vaccinated, they must bring him or her to the health center as soon as possible. More importantly, prevention is better than cure. Children are advised to always wash their hands. Kids must also refrain from going outdoors, especially to unsanitary places, as much as possible. Rex Remitio, CNN Philippines.
What are the symptoms of measles and how early should babies be vaccinated? CNN Philippines sat down with experts for thorough discussion.
Conjunctivitis, so namumula po yung mata. Parang may sore eyes ng konti. Coryza, yung sinisipuan, tsaka inuubo. It starts like that. Now, I think mothers are waiting for the rashes to come out. Pagka lumabas na yung rash,
yun lang yung marker,
doon na
no?
sila mag-iisip, no? And that could be too late because the fever could have gone up, the child could have complications. So, sa mga nanay nakikinig sa atin, kung nakikita nyo mapula yung mata ng anak nyo at tumutulo ang ilong at inuubo, dalhin nyo na po sa health center yan, lalo na kung hindi pa po sila nababakunahan or hindi pa nagkakaroon ng tigdas. It's airborne. So, kunyari, umubo ako ngayon at meron akong measles, actually, I could be sick without having symptoms for about 12 days. And I cough, the virus could be in the air and alive for about 2 hours.
Our national immunization program says that our children should be vaccinated at 9 months.
Okay, yung mga deaths natin, 3 months eh.
A
Oo.
booster, meaning repeat a dose of measles at age 18 months and above. Actually, what Susie was saying a while ago, that even adults are having, it's not just because they were not vaccinated. They were vaccinated a long time ago, but only with 1 dose.
We really have to rebuild the public trust that was eroded in vaccines over the past few years of what has been going on in the media and the politics behind the vaccination. We have to go back to the communities, double time sa atin to go to the communities, rebuild that trust again, to make them make the communities believe in what we're trying to give them, their right as every individual to their health.
Health officials scrambling to contain a measles outbreak in Metro Manila and other areas. Our Carolyn Bonkin checks the situation at a government hospital in Manila, where most of the affected patients are children below 5 years old.
There are at least a dozen children staying in this hallway of San Lazaro Hospital's pediatric ward in Manila. All 3 hospital wards for children are filled beyond capacity following a surge in the number of measles cases. Since January, over 1,500 have been confined in San Lazaro Hospital because of measles. 56 children aged 3 months to 4 years have died. With patients numbering more than double its available beds, hospital resources are being stretched to its limit.
Kung ang capacity namin, implementing capacity is only 150, tapos ang mga pasyente namin is more than 250 plus, syempre po, mahihirapan kami in terms of manpower, no? Kulang na ng doctors and nurses, baka maabusan kami ng gamot, and walang paglagyan.
As of January 26, a total of 1,813 measles cases, both children and adults from 17 regions have been reported at the Epidemiology Bureau. 26 have died. Aside from Metro Manila, measles outbreak has been declared in Calabarzon, Central Luzon, Western and Central Visayas. 5 other regions with high measles cases are being closely monitored. The health department said it wouldn't have reached this point if children had been given the measles vaccine. In the last 5 years, measles vaccination coverage has declined, leaving around 1.8 million children unvaccinated and vulnerable to the disease. Aside from paranoia brought on by alleged Dengvaxia deaths heard over media, some parents simply do not have the time or means to bring their children to health centers. Also, there are still people who do not have immediate access to measles shots.
Kasi po malayo yung center sa amin. Saka nung that time po nung pinanganak siya, lagi po siyang may sakit. Sa susunod na magkaroon ulit ako ng apong maliit, o di pababakunahan ko na siya.
Over in San Lazaro Hospital, there are those like Jeffrey's 2-month-old baby who got infected because they are too young to be vaccinated.
Bago bakunahan daw po, 9 months daw po kasi nakalagay sa record.
Because of the outbreak, the DOH will now advise vaccination to babies as young as 6 months old from the suggested minimum age of 9 months. Local health workers are also doing house-to-house immunization.
We're explaining po kung ano yung mga komplikasyon. Nakita naman po natin na napakadaling ma-spread within the isang household.
Ito po ay napatunayan ng dekalidad, ligtas at epektibo, at ito po ay walang bayad, binabayaran po ng inyong gobyerno mula po sa buwis ng taong bayan. So, napakamahalaga po, wag po natin ilito ang issue ng Dengvaxia.
Aside from children, adults are also advised to get measles vaccine, especially when traveling to avoid spreading the virus. The DOH confirmed that a Filipino who came from the Philippines tested positive of measles upon arrival in Australia. The virus has around 10 days of incubation period, so symptoms wouldn't automatically show at the border screening. Carolyn Bonkin, CNN Philippines.
With a voter turnout of 68.5%, 49.8%. Lanao del Norte refused to allow its 6 municipalities to join the new Bangsamoro Autonomous Region. Here's George Cahiles with that story.
Lanao del Norte has spoken. No reassignment of towns here. While residents of Baloi, Munay, Nunungan, Pantar, Tagoloan, and Tangkal affirm their intention to be part of the new Bangsamoro Autonomous Region with an overwhelming yes vote, the no vote resonate in the rest of the province.
The BUL still ratified, so it's just that the 6 municipalities are not, as for now, is not included in the Bangsamoro Autonomous Region.
Ang panawagan ko lang sana naman kay Commander Bravo na sana irespeto din niya kung ano yung desisyon na nangyari ngayong plebisito dito sa Lanao del Norte.
But the United Bangsamoro Justice Party or UBJP, the political party of the Moro Islamic Liberation Front, is not pleased with the outcome and alleges rigging of plebiscite results in some areas of the province. UBJP Deputy Secretary General Nagib C. Marimbo says gates of some polling centers in Sultan Naga di Mamporo, as shown in this video, were locked during the plebiscite, barring voters to cast their ballots.
Paano magkaroon ng mga botante kung pinadlock yung gate? Sinong bumoto doon sa loob? So yun yung dapat na tingnan natin seriously.
Sinarimbo says they will exhaust all legal remedies to stop the inclusion of votes from areas where supposed cheating took place.
Itatry natin na i-object yung inclusion ng mga plebiscite returns na galing doon sa mga presinto na alam naman natin na rigged.
Kung may mga allegations naman silang ganyan, they have to you have to prove the allegations.
In North Cotabato, yes wins in a double majority in the towns of Carmen and Pigcawayan. However, 2 out of 4 barangays in Alyosan lose their chance to join BARM, while the lone barangay that expressed intent to be part of BARM in Tulunan Town fails to achieve a double majority as the mother municipality did not allow their exit.
Nagpapasalamat tayo na nirespeto ng ating mga kapatid na mga Kristiyano yung kagustuhan ng mga Bangsamoro na mapabilang sa BARMM.
The poll body took some time in canvassing votes in Cabacan, Midsayap, and Pikit, some town with several participating barangays. Although the voter turnout only reached about 56% in North Cotabato, authorities say what's important is that everyone is safe and the conduct of the plebiscite was generally peaceful. From Lanao del Norte, George Cahiles, CNN Philippines.
The fight is not over for the country's third telco, Mislatel. Even as the Senate has allowed the ownership transfer of Mislatel to a consortium, Senate Minority Leader Frank Drilon tells CNN Philippines he expects the issue on the validity of the company's franchise to reach the Supreme Court. Drilon was one of 3 senators who voted against the measure approving the ownership transfer. Information and Communications Technology Chief Eliseo Rio says the Senate decision has cured franchise violations in the telco industry.
Ang implikasyon nito ay ipagpatuloy ang pagbigay ng third telco sa grupo ni Dennis Uy, ngunit itong mga bagay na ito ay aabot sa Korte Suprema, kukwestiyonin ang correctness ng pag-award at ng validity ng Mislatel franchise. At may kaso na po yan sa Supreme Court. At ang aking sinasabi paulit-ulit, sa akin po, kailangan natin ang third telco operator. Ngunit ilagay natin sa tama. Dahil pag hindi maayos, 2, 3, 4 years from now, babalik tayo in where we are today na hindi po matutuloy dahilan sa mga question na aking inilabas noong committee hearing at kahapon doon sa debate sa Senado.
This means that the whatever violations that were in the original franchise are more or less somewhat cured, no, by both the resolution, because these franchises are actually granted by Congress, and Congress can, well, of course, cure whatever deficiencies there are, no? And that is what they did.
The Senate decision effectively transfers the original Mislatel franchise to the consortium comprised of Davao-based businessman Dennis Uy's Udena Corporation, Chelsea Holdings Logistic Corporation, and state-run China Telecom. Suspended Daragal by Mayor Carlwin Baldo is asking the court to allow him to post bail. Baldo is the alleged mastermind in the killing of party list Representative Rodel Batocabe. Baldo's motion was heard this morning by the Regional Trial Court in Legazpi City, where his illegal possession of firearms case was assigned. The prosecution has 3 days to comment on Baldo's motion. Baldo has been detained since firearms were seized from his house on January 22. The double murder and frustrated murder complaints against him for the killing of Batocabe is now with the Camarines Sur Prosecutor's Office. Thanks for staying with us here in the newsroom. Our top story, a measles outbreak has been declared in more areas aside from Metro Manila. Over in Central Luzon, 5 people who died of measles were not vaccinated against the disease. The Regional Epidemiology and Surveillance Unit says 2 of the deaths were in Pampanga and 1 each in Bataan, Bulacan, and Zambales. Since January, 437 others have contracted measles, with Bulacan accounting for 144 cases. In Central Visayas, the Regional Health Office says the upsurge in measles cases started in August. Figures have not gone down since then. From January, 96 confirmed cases of measles were recorded in the region, most of them in Cebu province, with 82 cases, while Bohol has 14 cases. Meantime, after declaring an outbreak last year, Negros Oriental has reported 30 measles cases this year. The Provincial Health Office says the town of Manhuyod topped the list with 7 cases, followed by Bai City. The Health Department is closely watching the regions of Eastern Visayas, Northern Mindanao, Socsargen, Mimaropa, and Ilocos. The Eastern Visayas Regional Health Office in Leyte has recorded 161 cases of measles since January. More than half of the cases were in Leyte province. 8 people have died of the virus. In Tacloban City, customs operatives seized more than 385 million pesos worth of fake cigarettes yesterday. A dozen machines for manufacturing cigarettes were also confiscated from a warehouse owned by a Chinese national. Workers were present during the raid, but no arrest was made. 6 local banks in the country chipped in a total of 19 billion pesos to finance the 3rd Mactan-Cebu Bridge project. The loan agreement was signed today in Cebu City between bank representatives and expressway operator Cebu Cordova Link Express Corporation. The project will cost 30 billion pesos. 11 billion pesos will be funded by the parent company of CCLEX, the Metro Pacific Tollways Corporation. The 8.5-kilometer toll bridge will connect the town of Cordova in Mactan Island to Cebu City and is seen to ease traffic congestion in Metro Cebu. In sports, the country seeks to continue its mighty showing on the hard court. Mighty Sports Philippines takes on Iraq's Oil Sports at the 30th Dubai International Basketball Championship quarterfinals. The team hopes to keep the momentum going after sweeping the elimination round of the tournament. It remains unclear if Justin Brownlee will be suiting up for the match. Their match takes place 1 a.m. Philippine time. More stories from the newsroom. Health officials also closely monitoring other regions amid the rising number of measles cases.